Good day, everybody. This is Dr. Sanjay Sanyal, Professor Department Chair. This is going to be a demonstration of the pancreatico-biliary system. This is a supine cadaver. We have opened up the abdominal contents. I'm standing on the right side. Camera person is on the left side. That is the head end of the patient. So let's take a look at the biliary system first, and for that we shall start from the porta hepatis. This is the first part of the duodenum, which we have cut. I'm reflecting this. So what we see here, this is the region of the porta hepatis. The actual porta hepatis is very deep, and my finger has gone right inside. So this is the place where porta hepatis is located. So we shall show whatever we can see from here. We can see these three structures here. This is the hepatic artery proper. And we can see it is giving rise to the gastroduodenal artery. So this is the common hepatic artery proper. Then we have, this is the common bile duct. And deep inside, this is the portal vein. So these three are the structures of the extrahepatic portal triad. And behind, this is the region of the epiploic foramen of Winslow. So let's start from here. When I retract this, we can see this is the common bile duct. And opening at the common bile duct is this structure here. This is the cystic duct. So therefore, this is the cholecystohepatic triangle of Callot. And running in that triangle of Callot is this structure here. This is the cystic artery. Now we shall come to the gallbladder. The gallbladder is in the gallbladder fossa here. This is the quadrate lobe of the liver. This is the fissure for the round ligament of liver. This is the round ligament. We have separated the gallbladder from the gallbladder fossa. This is the peritoneum which was covering the gallbladder. This is the gallbladder itself, and we have removed it, and we are removing it now. After this, we have opened out the gallbladder, and let's take a look at the interior of the gallbladder. It was filled with thick bile, and we have cleaned out most of it. I want you to take a close look at the mucous membrane. You can see the mucous membrane, though it is stained deep green in color, the mucous membrane is velvety in appearance. This is because the gallbladder has got an absorptive function, and when the gallbladder bile becomes very thick, it can lead to gallstones. So this is the interior of the gallbladder. So now to turn it back, again we can see this is the cystic duct. This is the cystic artery. This is the Callot's triangle. This is the common hepatic duct, which is uniting with the cystic duct to form the common bile duct. This is the one which runs in the hepatoduodenal ligament to form the extrahepatic portal triad. It runs behind the first part of the duodenum. This was the location of the first part of the duodenum. And we can see it is stained green because of the bile. After that, it continues into the head of the pancreas. So we have split the head of the pancreas. We can see one portion cut here. We can see another portion cut here. And we are tracing the common bile duct inside the head of the pancreas. And there, further, if you zoom the camera closely, we can see this whitish structures here. This is the sphincter of Boyden, which is the sphincter around the common bile duct, and further lower down is the sphincter of Oddi, the combined hepatopancreatic sphincter. Now, I shall trace the pancreatic duct for you. This is the pancreas. This is the neck of the pancreas where we have cut it. So I'm going to show the pancreatic duct here. We have slit open the anterior surface of the pancreas, and we can see this duct here. This is the pancreatic duct. It is starting from the tail of the pancreas, where it is quite narrow, and as it moves further to the right, it becomes dilated and becomes wider. To continue, this is the pancreatic duct here in the neck of the pancreas, and we can see it here. And further lower down, this is the pancreatic duct, and we can see it is becoming covered by thick sphincter of the pancreatic duct itself. So here is the sphincter of the pancreatic duct, here is the sphincter of the bile duct, and further lower down, this is the combined sphincter of the hepatopancreatic sphincter of Oddi, and it is very thick, and we can see it also here. Now I shall pick up the cut end of the duodenum here. This is the cut end of the duodenum, and we can see the probe has gone into this opening here. This is the opening of the papilla of Vater. It is covered by this hood of mucosa, so we have put in the cannula here, and we can see the sphincter has been bypassed and we can now see the pancreatic duct. This is the location of the pancreatic duct. We shall put another instrument into the common bile duct now. And we can see this is the opening of the common bile duct. So this is the opening to the pancreatic duct. This is the opening to the common bile duct. So this is the combined junction of the hepatopancreatic sphincter with its individual sphincters. So this is about the anatomy of the entire biliary tree. Now let's mention a few clinical correlations pertaining to the biliary system. Gallbladder stones everybody is familiar with. A gallbladder stone can slip into the common bile duct, or there may be reflux of contents and it can produce ascending cholangitis. Then what will happen is this common bile duct will get dilated and it will produce the typical triad of ascending cholangitis, which is called the Charcot's triad. Fluctuating jaundice, recurrent pain on the right hypochondrium, intermittent fevers with rigors and chills. If it goes into septicemia, then we have what is known as Raynaud's pentad, which is associated with shock, hypotension, tachycardia, and alteration in mental status. So this is what we see in case of ascending cholangitis, which is inflammation of the common bile duct. Endoscopists, what they do is they cannulate where we have put in the cannula here with the endoscope, and they do what is known as endoscopic retrograde cholangiopancreatogram. They inject the dye, which goes in the reverse direction, and it outlines the common bile duct and it also outlines the pancreatic duct. As we can see here, this is the pancreatic duct, which I showed you just a little while back. If you note, the pancreatic duct forms a lazy S and the common bile duct goes up. So this is what is outlined by endoscopic retrograde cholangiopancreatogram. And if there are any stones, it will appear as a radiolucent shadow. The same endoscopist can also do a sphincterotomy or a papillotomy here to release stone, stricture, or any stenosis. In worst case scenarios, suppose a patient has got carcinoma of the head of the pancreas and it is completely obstructed the common bile duct. And as a palliative measure, if the common bile duct is dilated more than 10 centimeters, because it is running behind the first part of the duodenum, as a palliative measure to reduce the jaundice, we can do what is known as choledochoduodenostomy, so that the bile can drain and it can reduce the level of jaundice. It is a palliative measure which is done in advanced carcinoma of the head of the pancreas, obstructing the common bile duct. So these are some of the structures which I wanted to show you in the pancreatico-biliary system, and a few of the related clinical correlations pertaining to inflammation of the common bile duct and gallstones. What we cannot see here, if we were to look higher up, where this common hepatic duct divides into right and left hepatic duct, in that region there will be a shallow sulcus, which is called the Rouvier sulcus, but we cannot see it here. And above that Rouvier sulcus will be a small triangle, which is called the triangle of safety, where we can safely do dissection to remove the gallbladder, that is called perform cholecystectomy in case of gallstones. But that we cannot see unless we remove the liver. So these are some of the points which I wanted to show you in the biliary system and the pancreatic duct. Thank you very much for watching. Dr. Sanjay Sanyal signing out. Solomon is the camera person. If you have any questions or comments, please put them in the comment section below. Have a nice day. Please.